Good morning. This is Dr. Alrawi, the Chair of Oncology and Surgery. We give you an update about our progress of our conditions that we can do with the type of progression that is helpful to the patient. Today we are trying to talk briefly about minimally invasive thyroidectomy. Minimally invasive thyroidectomy is not a new thing. It is happened when I was in the United States in the 90s and 2000s, but however that has been abandoned for a certain period of time and now come back to the market based on the benefit and the patient need. The approaches for the minimally invasive, there are multiple approaches. One of them is transoral, which is called vestibular. The other approach, retroauricular. The third approach, axillary, and the fourth approach, trans-breast, we call BABA. Based on these, the access to the thyroid will be the same, but the distance will be longer. Rather than make a small incision on the neck for the thyroid, it will be made from these faraway access with the minimally invasive using ports. So based on the approach, the most common approach was in the past through the axillary approach, which is usually robotically and minimally invasive. Now we are people more in favor of transoral, which is the vestibular approach, which is faster, more accessible, and earlier recovery. We already have the team trained for doing these cases, and we are in the process of having high standard of care to avoid any complication of these cases. Still, everywhere in the world they are in the infancy stage. But we try to build that one for Dubai to get these cases being perfection and with a high quality, and for people, certain people that does not want to do the scar in the neck. Usually there are certain indications, single nodule, unilateral, little bit chance of cancer, and approach is easy, and usually try to avoid the scar in the neck. Good things that we are maturing in that right trial, and we are going to the next level of what we are doing. We have a good access and we have everything set up, and we are prepared for the training and the courses and also cadaveric arrangement, and based on that hopefully the trials will continue and will get you good results. But this type of surgery start to be available in Dubai based on the patient need and the indication of the surgery. We try to get the Center of Excellence now, the first Center of Excellence JCI accredited in Middle East outside the United States for the thyroid and the parathyroid. We are doing more than 5 to 7 cases per week, and hopefully with the minimally invasive increase the numbers in order to use the new Center of Excellence. We have a 24-hour hotline on our navigator. If you have any concern, do not hesitate to contact us. Thank you, and hope to see you next week.